You can find a link to the full report on unspent funds in government accounts on our website, newmexicoinfocus.org. Now, New Mexico Attorney General Hector Balderas announced this week that an investigation did not find credible evidence of fraud at 10 more behavioral health providers across the state. In 2013, as you recall, the New Mexico Human Services Department cut off Medicaid funding to 15 providers after alleging fraudulent billing and misuse of funds. I'm joined at the table today by an excellent group of line opinion panelists. They are Tom Garrity with the Garrity Group PR, Sophie Martin, an attorney and editor of DukeCityFix.com, Laura Sanchez-Rive, an attorney at Cuddy & McCarthy LLP, and Rachel Sam, she's back, editor-in-chief of Albuquerque Business First. Welcome to you all. In a letter delivered to legislators on Monday, Attorney General Balderas said, quote, "There did not appear to be a pattern of fraud for any of the 10 completed investigations," end quote. 3 of the companies who had been previously cleared of any wrongdoing, they're good, leaving 2 still remaining under investigation. Laura, 13 out of 15 providers have been cleared, but Balderas, his letter did say his office found some regulatory violations, but nothing that rose to the level of fraud. That's a quote there. How should these be handled from this point on? Should we just walk away from all of this, or is something going to happen here where someone's going to get dinged, it seems, those last 2? We'll talk about those first, and we'll come back to the other 10.
So my understanding from the letter is that the last 2, there's some issue about trying to get the right information, the right data or reports or whatever documents are needed to complete a full review. And so I don't necessarily think that we can assume that there's problems necessarily with those last 2. It's just an issue of continuing the investigation and making sure that everything is complete. I think what I did take away from it, you're right, there was some mention about that there were regulatory violations. But what I found interesting also is that, you know, when we first heard about this, it was like $34 million worth of fraud.
That's right.
When you really dig down into what was actually uncovered by PCG, I can't remember their name now, but they were basically the consulting group out of Boston that was paid $3 million, right?
That's right.
You know, they found specific violations, which I'm sort of assuming at this point were similar to what the Attorney General found. But those violations were then extrapolated, and I think it was something like 541 violations.
531.
Yeah, 531, and
Same.
basically they extrapolated that into millions of dollars worth of fraud. And I think that's a real problem, to extrapolate like that, especially when some of those providers had $2,000 worth of problems, $6,000, and to extrapolate that into millions of dollars and shut down these companies, I think is a real problem. And I think these calls for due process and holding somebody accountable for the impact that this had. We're talking about a lot of jobs, local New Mexico companies. There are auditors here also in the state that could have been used instead of using an out-of-state audit firm. And I think all of that speaks to, how are these decisions being made? Because they have serious impacts on our economy here and on our system of delivering services. And I think a lot of people have been impacted, not just on the jobs front, but on the service delivery front. And I think somebody needs to be held accountable for that.
Sophie, there's a lot of call for that out there. Representative Lujan Grisham has called for a federal investigation. Because people have been dinged. I mean, when I read that folks are having trouble finding a job,
it's more than dinged. It's more than dinged. I mean, we talk, we talk about like an industry being decimated. This industry wasn't decimated in New Mexico. It was nuked. These organizations, companies went out of business. These people lost jobs. We've recently heard that unemployment is now having to be paid to some of the individuals who initially it was thought they could go work for an Arizona company, but it turned out they couldn't. Services have been hurt. And bottom line, the administration did not need to go nuclear. It was not a requirement that they do so. The federal government doesn't require it. The state government doesn't require it.
But they denied that for a long time, didn't they?
Yeah,
even the press pointed that out for weeks and weeks and weeks.
When you dig further in, though, you find they did not need to do it. And so they could have dealt with this, frankly, like grown-ups. Show us what you've got, we're going to dig deeper, we're going to take a look, but we want to keep these services in place. Instead, what we have is an administration that appears to have contacted the Arizona firms really early in the process. And so it looked like the fix was in. And that is a real concern to a state where we care about local business. We have a governor who at least claims that she wants to build our local economy. That doesn't appear to be happening. We had a thriving industry. More or less, we had businesses, we had people being cared for, and I think the callous way in which the administration just wiped them out does not reflect well on them. Now, perhaps they thought we will be vindicated in the end, but I would have done a little bit more investigation to make sure that I was certain that I would be vindicated in the end, rather
good
than, as
point.
Laura said, the extrapolation that they did do.
That's right. A software problem, basically, and a bunch of people are out of work. It's incredible. Rachel, you know, Sophie mentioned the $18 million that went to those Arizona firms. 5 of them, 2 of them have now said, you know what? There's no guaranteed money here. How does a company get out of here with no penalty in this industry? That's incredible to me, that you can just say, I quit, basically, and there's no penalty.
Yeah.
You just take the money and run. It's amazing.
Right. And on the other end are, you know, you're talking about the service delivery.
Right.
You're talking about one of the most vulnerable populations in
Yes.
New Mexico. And these transitions are just putting more and more stress and more stressors on them.
Absolutely, Tom. You know, it breaks your heart when you read, for example, YDI, who was one of the outfits that settled. By the way, one of the 2, they settled for $240,000. They've gone from servicing 750 to 1,000 people down to like 250 to 350. That's an amazing difference when you think about it as a percentage of people served. And I ask again, I've been asking this all week since this all came out. How do we make up ground for that, for people that have been so severely impacted?
Well, I think that's where the courts, you know, come into play, and you know, there are, you know, entities that have already, you know, filed some, you know, civil suits along those lines, and but you know, for those who have settled, you know, that's the risk you take,
Right.
You know, and it's at that point it's a business play. But you know, I think what all this is reinforcing is what we've seen is the distrust of state government has increased substantially over the last 5 years. And it's because of situations like this. You know, Laura, Sophie bring up great points as far as the impacts on small business. Rachel as well, and most importantly, the 30,000 of the most vulnerable residents that have been negatively impacted, because you know, it's not like, you know, anybody who would just typically go up and say, okay, well, I'll just find another provider.
Right.
These are folks who you turn them away, and it'll take years for them to, you know, really trust the system to come back again.
That's right.
And it's rebuilding that trust is the most difficult thing right now.
That's right. You know, Laura, when I was watching that press conference with a woman that formerly ran Hogaris, and she was upset, there were tears. I mean, this is a business that was in business for over 40 years. You cannot take that kind of experience, background, instinct, you cannot replicate that in 18 months after someone's been doing their thing for 42 years. Every time I drive, I don't know if you guys have been by Hogaris, I see the empty parking lot and I keep thinking, how is this possible? How could this have happened? It's just incredible. So where do we go from here? How do we take this, how do we take a corner here? Because we have a legislature looking at hacking almost $20 million out of behavioral health type stuff. No one seems to have learned a lesson here. How do we get the message across?
Well, it's a big,
It's a big one.
it's a big question.
Two big ones, actually.
You know, I mean, I think what's important though is that this administration really take a step back and recognize that there were some missteps along the way, and try to figure out how to move forward and include some of these.
Are you hearing that in their quotes to this point, that they're ready to move forward?
No, not at all. I mean, I think they've hunkered down on a position, and they're not really looking to, you know, change that position. Although, you know, they did at one point say, you know, they've turned it over to the Attorney General's office, and they're waiting for the Attorney General to do their investigation. Well, now that has occurred, and I think what's important is to clear the air. Not just, I mean, they've been cleared criminally, but there's still that stigma, I think, associated with a lot of those small businesses, behavioral health providers, and something needs to be done to work with them to try to, you know, resuscitate our failing behavioral health system. And that's something that, you know, real leadership is required here, and that's something the administration could do and should do to try to get things back on a level playing field. I mean, you talk about Ogatis and YDI both.
Sure.
Their clientele was really the most vulnerable people in our community, and to think that they're not now receiving the services that they were entitled to, that they had been receiving, and there's been this huge interruption in their lives. I can't imagine, you know, what kind of effect this has had over the last few years on those families.
Absolutely.
So I think it's really important. It's a public crisis that the administration needs to step up and fix.
I wonder also, Sophie Martin, if United Health is going to be dinged here at some point. I use that word a little loosely, meaning that the Arizona firms were under their umbrella. They were recommended by United Health to come in and help fix this thing. It didn't happen.
I actually disagree with your concerns about your thoughts about the Arizona firms. You know, they came in. I think they saw a business opportunity. They came in. They discovered the opportunity was not what they believed it was, and I actually think that they do have the right to make business decisions, because for them that's what that was.
Sure. Is it okay for you that they got out with no penalty, however?
What would the penalty be based on, I guess is my question. Did they-
I can answer
think it
that a
depends
little
what the
bit.
contract says.
It depends on the contract. And
yeah.
if the contract was set up that there was a certain amount held back, if you didn't meet some certain
But
performance things or be
this
here
is
for a while,
if. We don't know.
Absolutely,
And so,
absolutely.
really, I think what the question is do we trust that our state
Right.
is holding them to the contracts that they signed?
Mm-hmm.
I'm not sure that we have any reason not to, but I don't have that
That's good enough
information.
right
I haven't
now.
seen
Absolutely.
it reported. I do think, though, to Laura's point, I think there is a real opportunity. I mean, we give tons of money in economic development funds for 400 jobs here, 300 jobs here, bring these things in. We could be, and I think rightfully should be, looking at that industry and saying, what do we need to do to bring those jobs back, bring them back in New Mexico? Because clearly we need the services. And so rather than looking to companies in other states, my hope is this administration would work with those providers. Do I think that's likely? No.
Interesting. What do we go for business? Where do we go from here? There's an impact on business with this kind of
Absolutely.
thing.
I think it makes a lot of people nervous to see that something like that can happen, that a 40-year provider, can be gone like
Right.
that. I think that, maybe what we hope for is that down the road, even if there isn't a revival with the same providers, maybe down the road, once some of this has passed, there will be a new generation of firms that want to explore and get the chance to explore.
We can hope. Well said. Absolutely. Up next, an in-depth discussion on the ongoing challenges people are facing here in New Mexico as they seek behavioral health treatment.